Good morning. I'm Charlie Alexander with the Living Legacy Foundation of Maryland, the organ and tissue donor recovery program serving much of this state of Maryland. I just wanted to provide an update on our activities from the beginning of this pandemic through to the next 6 weeks that we feel are very critical. The LLF closed its administrative operations on March 12th. We moved most of our work to remote work sites, and we did this to minimize any social interaction between teams that might contribute to the spread of this disease. Our clinical teams, our essential teams, are continuing to operate as per usual, but we've of course made some changes in how we are facilitating organ and tissue donation. I want to cover those briefly with you here today. First, I want to say thank you. The month of March was very busy for organ and tissue donation. We were able to facilitate 60 transplants here in this area and continue to serve the patients that we're here to serve. So thank you for all your continued efforts, both on behalf of our teams and also for our hospital partners. What are some of the steps that we're taking to address some of the challenges that we're all facing? We are trying to minimize our in-hospital time. We are sending our teams on site for any potential donor where brain death is imminent or a family discussion is also imminent. In the meantime, we're making our best use of remote workups. We have remote access to medical records. We can do evaluations. We can look at donor suitability without putting our teams in your ICUs. We will continue to always be present for our donor families. Our mental health professionals stand poised to be there to support families through the death and dying process. We recognize that there are visitor limitations and in some cases no visitors allowed. And in those situations, we are working by phone to support those families. If a family is present, we will be present. We're providing PPEs to our teams. We understand that there is a very substantial limit in supply for these very important pieces of what we do, the work that you do. And we know that we had to play our part and our role in providing these supplies to our staff, and we're doing so. We also have been very fortunate to gain access to rapid COVID-19 testing. From the very beginning, we have screened every one of our potential donors and actual donors for the presence of COVID-19 virus. We want to thank our partners at Johns Hopkins Hospital and the University of Maryland Medical Center for making this happen. I want everyone to know that every organ donor in our area is being screened for this virus prior to any surgical recovery. We're also following any and all CDC guidelines for keeping our team safe and therefore keeping your team safe while we're all interacting together in tight quarters in the intensive care units. Any of our staff members who expresses a possible exposure or any symptoms that would indicate the presence of COVID-19, we are following any and all CDC quarantine and testing criteria. And we have the ability to rapid test our teams for the presence of the virus if indicated. The second part of April and the month of May still have a lot of uncertainty. We still believe that we're about a week away from the peak need for ICU beds, ventilators, and our critical doctors and nurses in our hospitals before this starts to subside. And we are going to continue to take all the measures I just mentioned. In addition to those measures, we are working to try to minimize our ICU time. We know that the beds are precious, the ventilators are precious, and there are people waiting for those resources. So we are coming up with some strategies to try to minimize our time in the intensive care unit, while we also screen any and all members of our teams and surgical teams that would be present for an organ recovery. We want to make sure that they are asymptomatic and they have no reason to believe that they may be currently infected with the virus. I cannot say enough the thank yous to the people who have made organ and tissue donation happen for this last month and who will continue to do that in the next 6 to 8 weeks of this challenge. Without hesitation, we have received routine notifications of potential donors. We have seen incredibly high quality family care, and we've seen a welcome response to including our teams in this death and dying process where it's so difficult for everyone in these unique times. For that, I say thank you. I say thank you to my teams. I say thank you to you, the hospital partners, and your continued support for organ and tissue donation. Thank you, and please stay safe.